Hello and good day. I am Christine and I will be presenting my clinical case study for ultrasound, which is US14. So just briefly the information about this patient. This patient is 41 years old male, has long-standing history of hypertension and diabetes. He also has signs and symptoms such as pruritus, lethargy, lower extremity edema, nausea and emesis. So the patient has undergone previous examination and I'll have to decide what is the most likely diagnosis for this patient. So the most likely diagnosis for this patient is called chronic kidney disease. So this patient will have to undergo renal ultrasound, which is these are the imaging findings. So I will go from the patient preparation for renal ultrasound first. First, the patient will have to fast NPO 8 hours prior to the procedure, and morning exams are preferred for abdominal ultrasound. In this case, is renal ultrasound. It is in order to prevent gas build-up. So it will facilitate the scanning and will obtain better images. The patient also have to stop smoking, no chewing gum, no smoking. And for renal ultrasound, patient has to drink 700 ml of water to fill the bladder so that the bladder can act as an acoustic window. And we will also have to explain the procedure to the patient before the examination. As for the imaging protocol, for renal ultrasound or abdominal ultrasound, we will be using the curvilinear transducer. The frequency is 3.5 to 7 MHz with Doppler capabilities. Because in renal ultrasound, we will also be using the Doppler. So the first step is we will apply the coupling gel, and then we will use the sweeping technique because we want to cover all areas. Then after that, we will obtain images and measurements of each organs of the abdomen in two views, transverse and longitudinal. For the imaging procedure for patient positioning, first we will have the patient position supine initially with pillows under the head, and we will provide blankets also for the patient comfort. Then along the examination, we will ask the patient, we can adjust the patient's position to suit the region of interest. For example, we can have the patient to lie in oblique lateral. This is in order to take images of some structures such as the kidneys, spleen, gallbladder and liver, because they are organs that we cannot scan without changing the patient position. So when we put pillows under the head for support, we will also pull up the patient's shirt because we want to expose the scanning area, which is the abdomen. Then we will put blanket over the lower half of the patient's body for comfort. Then we can proceed to scanning, take the ultrasound scanning for the patient. As for the clinical reasoning, why is the most likely diagnosis chronic kidney disease? Because when we look at the patient's symptoms, they are mostly associated with CKD. For example, the lower extremity edema. This patient has lower extremity edema. This is actually due to water retention. It is possibly due to water retention because due to the renal failure. Then the patient also has superficial excoriations from scratching. This is because the patient also has pruritus, which means severe itching of the skin. This may be due to loss of perspiration because of renal failure. And when we look at the history of the patient has long-standing history of hypertension and diabetes. These two factors are also important risk factors of chronic kidney disease, which is why this patient is most likely have chronic kidney disease. Then for the image findings of the right kidney, we can see anechoic rim surrounding the renal capsule, which may indicate collection of fluid or perirenal effusion. The anechoic rim is this one. Usually the kidney will have echogenic wall, but in this case the echogenicity of the kidney, the renal capsule, is lost. So we can see that anechoic rim. There is also poor corticomedullary differentiation, and this suggests renal parenchymal disease also. There is also poor visualization of renal pyramids and renal sinus, and we can see there are areas of irregular margin here. And when we compare to the liver, the echogenicity, the kidney also has increased echogenicity compared to liver. Normally, the liver will have greater echogenicity compared to the kidney. So in this case, there are some problems with this patient's kidney. As for the left kidney, we can also see loss of cortical echogenicity, irregular margin, and increased echogenicity compared to the spleen. And usually we use the concept of PLSK, which is the kidney has the least echogenicity compared to pancreas, liver, and spleen. So in this case, when we compare this echogenicity to the spleen and the liver, the kidney has greater echogenicity, which is not normal. That is the image findings that I can get from this patient's image. So for what is the role of ultrasound for this patient's case? The role of ultrasound is to determine the size, the echogenicity of renal parenchyma, and also to rule out any obstruction. Then ultrasound also assists in identifying the extent of renal parenchymal damage and the possibility of its reversibility. So from ultrasound we can see how bad is the renal damage, and we can see if it is reversible. So ultrasound also evaluates renal function by measuring the renal length and the cortical thickness, and important clinical decisions can be made based on these measurements. For renal longitudinal length, as renal length decreases, it also indicates decreased renal function. And renal parenchymal thickness and echogenicity also evaluated in ultrasound, and the echogenicity is compared to that of the liver and the spleen, such as the one that is used for this patient's case. So the conclusion is this patient has chronic kidney disease, and it is also characterized by the ultrasound image findings in this case. So that is all from me. These are the references that I use. Thank you.